So you both are with the local fire department. You both work in Bellingham? Are you?
We work in the fire service in Whatcom County.
Okay. So, kind of tell me, I guess why did you want to come on and say? What's got you? Obviously, it's the mandate here that's got everybody kind of feeling the heat and the pressure of everything. Mm-hmm. So, tell me, how's it affecting your local guys? I mean, is there a good amount of people that are about to be let go in Whatcom County?
I would say, yeah. I mean, I'm biased, so one is too many in this scenario. But there are many more than one. I can't give you an exact number, but probably around 30 firefighters that I know feel pretty passionate, and it could be more. What do you think, Michael?
It's definitely up there. And again, it's not just the 30 in our local fire department. It's the nurses we work with, the other volunteers we work with. So this goes far beyond us.
Right. So looking in the medical field, we've heard it's like a third of people who either aren't vaccinated, who don't want to be, or are now looking at like, hey, I'm vaccinated, but I don't like the mandate. I don't like being forced. Right. And I also don't like it's happening to my coworkers. Or they're saying, I don't know if I want the booster with the efficacy rate just like taking a plummet down.
Well, and I think the big thing is, and when you talk to our folks, our members, when we discuss this issue, I think there is folks who have been members who have been vaccinated, but are definitely against a mandate.
Right.
And when I'm speaking on it, I say, look, it's not just those of us who could be terminated over this issue, but it's who's left over. So you've got all those additional firefighters that will now have lost a segment of their workforce in a relatively tight personnel as it is. It's not like we're flush with people. It's been historically difficult to keep the staffing levels where it needs to be. So you lose, say, 30. That's a huge segment of our group. And who's left behind? They're going to be working all those forced shifts, forced to stay at work and do an additional shift after their 24 hours because there's not enough personnel to fill the seats. Or, and I couldn't speak for the fire department, nor would I, but if there's not enough personnel and there's not enough to go around, there is a possibility that you might have to close a rig down if there's not enough folks. So and that's totally up to each individual agency and the department chief and how they plan on managing that. But it's either work the additional workforce, to the bone, or close stations down. It seems to be, and I'm sure there's other things, but those are really the two big things that will happen. So it's not just that. It's not just those of us getting fired, but it's those of us left over. And then, of course, what happens when you don't want the next thing that comes, and it'll be too late?
Right. And so, as we've been doing a couple other podcasts, kind of talking about the decline, the like downward spiral of everything right now due to the current leadership, and you've got this, legislation for police. And now you've got this, like, it's not really safe. The safety is going down. I mean, Whatcom County is not the worst place in the United States, is now I'm trying to say, but the safety is declining here. The public is less safe now than they were, 2 months ago. And it was already declining. And now you're going to try to take out, the staffing of nurses, and you're going to take away, like, the first responders. Aren't you guys already feeling that the legislation that's come down against the police? Are you taking on some of those calls now?
And you speaking specifically based on legislation and how
the impact of that legislation. I mean, isn't it already mounting on you guys? Because, I've talked to Sheriff Bill Elfo, and, now some of that work is being shifted to you guys.
Yes.
So your workload is going up and your staff, your members are going down.
Well, yeah, I mean, if you think about the shifting of work just on, say, a welfare check, which would historically have gone to the police department.
Life status questionable.
Yeah, life status questionable. These types of things where these calls that would come in that would ordinarily go to the police department, those have been shifted over to the fire department. And there really wasn't any time to pivot, to be honest, on that. So, I think there's great leadership at the top. Our fire chief is a good chief, right. Chief Hewitt. He's excellent. And the leadership that we have, the chiefs that we have, strive to do the very best that we can with the hand that was being dealt. But I will say that this sort of unfunded mandate is how I guess I would have to call it, because there was no additional funding or nothing additional for the fire service that was handed down from the state, just this new shift. And that has caused a significant increase in workload. If you were to do a public disclosure request and request call volumes, I think you might find that the call volume since then has significantly increased from the year previous.
Right.
And certainly our crews are feeling it. Certainly we are noticing it at the fire station. So I will say that, it has certainly created a problem. We're having to pivot now and shift and figure out how our processes and procedures are going to adjust to it. And, we've got a great group, so we're going to do the very best we can with what we have. But then when you add that additional layer of potential layoffs on top of this unfunded mandate, it is, and then you look at what's happening in the healthcare field at St. Joe's, boy, this feels a little bit like a perfect storm.
Yeah, and Doug Erickson, he thinks that this is another way to defund the police, because if they won't take the vaccine, they're gone, and then there goes funding along with it. So he, Doug's saying, they've been trying to do this, and now it's like perfect way to do it.
Well, I hypothesize. I think there is a defund police, but back on to the additional legislation that was put in force, right? If you're a state legislator, you say, well, I'm not for defunding police. However, I'm going to create this unfunded mandate. Well, police departments, particularly in a city, police departments, fire departments, they're a general fund. That's how they're funded, by the general fund.
Right.
And so basically, it's like I look at that as a pie, and where you put the knife in the pie, is how much funding you have. So, okay, you create this unfunded liability. You push these calls from the police department to the fire department. Well, what's going to happen internally with the city when you start looking at budgets? Well, now all these calls are going to the fire department. There's no additional money coming in. So now the cities are faced with looking at these individual budgets. And could that mean, that's the question I have, does that mean you're defunding the police in a different way? You're roundabout defunding police because now the cities have a decision to make when it comes time to budget every biennium? So that's my hypothesis, is that, shifting the calls to the significant level that they are over to the fire department. At budget time, there's questions that are going to be asked, and there's justifications that have to be made for the fire department, police department, and all the other departments in the city. And so what does that look like? And I think it's possible that it looks like less funds for the police, because now you have to add some of that funding to the fire department in order to try to figure out how they were going to close the gap on an unfunded mandate.
Right.
So that's my hypothesis there.
Yeah. So, Michael, you guys have been doing some kind of gathering of people throughout the state, working with people. Can you tell me a little bit about that?
Yeah, initially when this kind of hit us, we believed that we had a little protection with the union, with availability to work our jobs unvaccinated to this mandate. And we realized that it was short-lived. And when we went to look for support locally, statewide, we didn't have it. So that forced us to kind of go find other support. And we found that support with other unions, other workforces, nurses, shoremen, DOT employees, and we were able to create a network of communication from locals all the way from up here in Bellingham to down south in Vancouver, where we just started gaining communication, gathering lawyer information, ways to fight the mandate, ways to talk about the mandate, and just really opening up a line of communication we didn't have previously. We have this huge push of the only way we can help you is basically through terror. We're forcing you potentially lose your job, lose your finances, your ability to put food on the table, as I would always say, and just no communication. As soon as we mentioned a mandate or a vaccine, we'd be labeled anti-vaxxer, a certain.
Then are you an anti-vaxxer?
No, and that's the thing. I mean, this group I'm talking about, it's vaccinated and unvaccinated. As Robert talked about earlier, these are people that actually initially got the first dose of the vaccine and is actually concerned about boosters. So this isn't just one particular group. I mean, these are men and women, multiple different fields, all communicating to gather information, to have these conversations that, like we're having now, but mainstream media is not.
Right. Yeah. So I guess, I told a few people that I was going to be talking to you guys because they saw you Monday, right? Yeah. And they were like, oh, well, can you ask them? Because, people are really hungry for, is people who are vaccinated especially, wondering about the booster coming out and seeing the efficacy rate decline. They're wondering, and now we're seeing more and more people going into the hospital who are vaccinated. We're told a majority in the hospital are unvaccinated. Even though I've been told, I don't know if you can tell me, do you know if that means that they're not fully vaccinated? So if they received one vaccine or one shot for their vaccine series, if they haven't received the second, are they considered vaccinated or not?
I couldn't speak to that. I would say that fully vaccinated is a general term, and for me, I would say, the question is, what does fully vaccinated mean?
Right.
And is that a moving goalpost?
That's my thought, because I've had one ER nurse tell me that it means that they've had both, and if they're eligible to get a booster, it would mean both and a booster.
Right.
And that is the numbers that they are reporting to the public, whether they're vaccinated or not. And so, to me, if we're looking for some real concrete data in that science, it's kind of hard to get that when they play with words and create the data that's moving all the time.
Yeah, and it's tricky because initially when this all started, we had to do a pretty knee-jerk reaction and start protecting ourselves and not only our family.
Yeah.
I mean, when this first started a year and a half ago, we had firefighters isolating from families, living in RVs and hotel rooms because we didn't know what was going on. So
that's what we did in our house.
Yeah, it forced us to take real drastic measures and understand what's going on. So the information that was being provided was hit and miss, goalpost to goalpost, and just not as clear as we would like. And we understand this is a new thing. I mean, we're not going to have the right answers for the right treatments and the right things to do. But again, we had to gather this information and start practicing real world and what we were going to do. And like Robert was talking about earlier, is our department stood up to the challenge. I mean, we changed our PPE standards, we changed our rig standards, our transport standards. Protecting not only us and our families, but the patients we were serving. So, but again, it gets back to that information you were talking about, Ashley. It's just not easy to find that information. I mean, you go into fully vaccinated or vaccinated, and you get into PCR testing, and the cycle threshold on PCR testing has changed throughout this pandemic.
The gold standard.
Exactly. Yeah. So it was in the high. It was in the, and it's tricky because. People start thinking about conspiracy or things, but I'm just asking basic questions. And when I watch a video on the person that created PCR testing and he's telling me it's not a diagnosis tool.
Right.
And this is only used for an emergency scenario, that our government would say we are in, and that CDC is actually getting rid of the PCR test come December.
In December, after the election, I might add.
Yeah, and again, these are just basic questions.
I suspect a delay because I'll be curious to see what else they can come up with. You when I ask the question, has the PCR test been validated? It has not been validated.
Nope, authorized.
And is it under emergency use authorization still? It is under emergency use authorization, and it doesn't isolate a specific. It's not. you can't take a PCR test and have it pop up, yes, Delta variant. And when I hear from my own doctor, hey, why is it that I'm seeing and asking the question about, if Delta variant's being tested for and I get no symptoms, his response was, well, what we know is...
Right, what we're being told is...
What we know is it's the dominant strain. So if you have COVID-19 now, it's Delta. Well, so then it's funny because the, Whatcom County Health Department has 0 cases of influenza A and B, and now COVID-19, the original, the OG COVID-19, doesn't exist anymore because now it's Delta and we're counting things as Delta and we're looking at it in the form of a Delta. So it's just curious.
Yeah.
And it's just one of those things that creates more obscurity, which doesn't make those of us feel any more informed.
Right.
To step up and, to say, okay, let's go ahead and take this vaccine.
Take the risk.
Yeah. Right.
And so it's a really tough thing when your values on something like this are now being used as leverage against your ability to earn.
Provide. And,
yeah. And provide.
Yeah. Well, and so what's funny is my pediatrician, we were just in there taking my older kids. He wants my kids to get the COVID vaccine, the influenza vaccine, and HPV, like all at the same time. And I was like, well, we're not going to do HPV because we haven't, and we're not going to do COVID at this time. And he sat and drew me a picture and like went over, like totally trying to convince me. And I, who am pretty firm, I'm firm, not now, not yet. That's not yet, because I'm not an anti-vaxxer, not yet, and not mRNA. They're developing others I'll keep an eye on. But not this. And he even had me feeling like guilty or like bad because I wouldn't take his advice, because I've taken his advice on everything else. I've trusted him. And he told me that there has been some flu, like in his office. So where's the data going?
Oh, I see.
Right?
Yeah.
But he said that they've gone to the hospital. He's like, this is going to be a really bad flu season on top of COVID, so you need to get your vaccines. But then, like, you try to find this, and it's gone. So where's the data so we can make an informed choice?
And, I think, and this is funny to me because, again, I'm going to go back to having a conversation with my own doctor so that I want to make sure that I would never, as, we're EMS providers, so we would never share anything about anything.
Right.
But so I'll go with my own experience as far as what I'm noticing with my own doctor. And my questioning is, if we're forcing someone to take something. So we've been part of studies before, right? You do this study and there was a control group and there was data collection and there was paperwork before. There was permission from the patient to start in the beginning. There was data collected during, data collected after, and all of these things got inputted into one specific data main collection point, and then the results of that study is then published as from there. My expectation is that we would see something similar to that if we're doing real-time testing on human beings out there in society. And so when they don't have an answer for it, it feels a little bit more like ideology and a little bit less like science.
Right.
And so that's a concern. And so am I wrong because I listened to, I think his name is Dr. Nuri, who invented the PCR test. Yeah. And then you have, Dr. Robert Malone, who I've heard multiple times eloquently speak on and very clearly speak on his concerns, and he holds the patent for the mRNA.
Right.
And so I say, and even like in my own family when I'm having this discussion, I'm like, wouldn't you, if you invented something, right? I would look at you, and you invented it, and you hold the patent on it, I would look at you as the expert.
Right.
Why is that expert unable to get his message out other
being totally canceled.
Other than alternative media areas?
Yeah.
And so then, if I was to share said video from that person in a very legit interview, what I would get back is, well, that platform has all this other crazy stuff on it, so that guy must be, we have to discount anything he says. Or, Christina Parks, Dr. Christina Parks, if you look, she's amazing. She did some testimony in Michigan, and she is, I'm trying to remember her credentials, but if you look her up, her credentials are fabulous, and they certainly relay confidence in me that this person knows what she's talking about. And she did an amazing interview testimony. I recommend you look it up, Dr. Christina Parks. And then I saw yet another interview by her. And then what I received back when I was to share such a thing is she used this term, this term over here, and they said that they shredded that document when really they just omitted it for this other reason, and da-da-da-da-da. So that whole testimony that she just gave, that amazing testimony with studies and data and how she passed it along, none of that matters anymore because she used this term over here where she said shredded when it was omitted or something like this.
Play on words again.
It's just a constant play on words. And the other thing that I think is the most, this censorship of conversation, people should really ask themselves, like, you've never seen this before. Why are we normalizing this? Right? Why can't we have this conversation?
Right. And, so this kind of gets back to the whole, like, big picture stuff, right? Like, I think that people are starting to see, like, it doesn't feel like it's about COVID. 2 weeks flatten the curve. What the heck? To not overwhelm our institutions, right? I mean, don't overwhelm the institutions, but then take away personnel from the institutions. So, like, I don't know if it was you guys who was telling me or someone was telling me, it's not about their capacity for beds or space.
Right.
It's about who can take care of them, right?
Right. It's not the building isn't big enough.
Right.
It's staff per patient.
Right.
That's what.
Yeah, they're tracking on staff beds.
Staff, yeah. So how the staff can treat
and care for
who's there.
Right.
So if you're understaffed, you could say I'm understaffed, or you could say we're over full.
Right.
And so, again, play on words.
Yeah, so people commonly, because a normal person would think, well, there's only like 30 people with COVID at the hospital. Well, how was that like that's not like compared to the population of our county, that doesn't seem like a lot. That doesn't feel like an overwhelming of the institution, right? Mm-hmm. So I think that's something that's good for people to know, because that seems like a hospital problem, big time. Mm-hmm. And it seems like they're making it worse, and they're not doing what they should be doing. And so big picture, though, like, just everything is so upside down and backwards, and it's the schools, and it's the hospitals, it's the policing, it's everything. And now you've got this division in society. It's so big, and you've got people who are just like, hey, I just want to make my own choice, and the other side's like, I hope you die and you're in a body bag next week. Don't you dare come to the hospital. Those are nurses on Facebook. And, they're talking about, they want cops. Wow. They want to see cops' social media. What about these nurses who are saying this to people? Shouldn't they lose their nursing license or be held accountable? Shouldn't the other side be held accountable on this? I mean, it's bad. It's really bad on social media, and especially towards the nurses or first responders who just want choice, right? You just want to be able to choose. And then you've got restaurants, because we don't have a mandate in our county that says you have to be vaccinated to go into a place. You don't have to show proof. But we've got restaurants who have jumped on that immediately before counties even did it. So, where is that medical privacy? Do you guys know? Are they allowed to ask us that?
Boy, I wish I could answer that question,
I
because I thought it was, but I mean, I'm not a lawyer. We try to stay educated on HIPAA. I mean, what do you think, Michael?
I mean, department-wise, I know they can gather that information. Whether they can post that to everybody is a different story.
The employer can gather that.
But civilians, I'm not.
Civilians, because I mean, they're saying, well, this has nothing to do with HIPAA. This is not HIPAA. That's what, that's what they're saying. And I'm wondering, is it that, so the governor is saying, I'm taking my directives from the health department and the data and all this, and that's why there's an emergency because of that, right? But then he's weaponized all the, the liquor board and the health department and L&I, and they're all just coming in and doing whatever the heck they want. Mm-hmm. And you've got people telling on businesses and tattletelling or creating a story that's not even true because they don't like a business. So we just have this massive divide going on. It was really bad last year, and I feel like it's going to get the sides of division are going to get much bigger because now you have people who are stepping out and speaking. And so I don't know, maybe it's the health department that's giving businesses the right to ask that. And I mean, but I don't know if it's legal. I didn't know if you guys knew. So
No, I think it
like if the health department or the county deems
we need
it an
some
ordinance,
judges. We need some judges.
Yeah.
So what I hear on a pretty regular basis is people just, and I say people, like, some folks maybe that I work with or some folks that are in the community that are like, they can do this. Or even a lawyer says they can do this. Or even the DOJ says they can do this. And so, but lawyers and your folks you work with, and they're not the judges. Mm-mm. And that's what I think we're waiting to see is what will a judge rule in this situation?
If you can get it before a judge. So that's the problem here. To get to the judge at all is the Washington State problem, it seems like.
Well, yeah, I wish I could speak to that. It's not in my wheelhouse. It's not my expertise. But I will say that there are legal counsels that say that there is a pathway through this. And if you're going to be an advocate and you're going to be a union, let's say, or you're going to be an advocate for an employer or for an employee, then you need to stop looking at the lawyers that say you can't do this and start looking at the ones that say you can do this.
It's like the school boards saying that our lawyers say we can't because we'll lose our insurance.
Well, let's find some new lawyers that,
right.
Because if that's who we're looking towards and it's the legal counsels, then, I think you need to look for the one that is going to protect your rights. If you can find the ones that will really step up to the plate, because this is not an easy fight. I can't imagine that being in a law practice, this coming across your desk, if there's low hanging fruit over something like this, then that's what, maybe that's where I want to put my time and effort. But we need those lawyers who are brave enough to step up and look at all the laws in a more holistic way.
Right. And
try to help draw a pathway to protecting us from this mandate. Mm-hmm. And so I guess that would be a plea from me is if you're a lawyer, if you're an attorney, we need you now more than ever to step up to the plate and do it because do it not because it's don't do it because it's hard. Right. That's my thing is we're firefighters and we come up to things all the time that look seemingly impossible that we have to figure out how to get through because it's not failure is not an option. That's what I need out of an attorney right now. That's what we need out of an attorney right now.
Yeah, and I know we've been, in communication with a lawyer that's been helping local businesses, and Dan from Z's Recycling. They just went, and they tried to challenge those orders, and it got met with they didn't even they couldn't even present their evidence. So now it's back to the drawing board. But that's the point. Keep coming back until something hits. Yeah. And so now it's okay, can we bring something against, the fact that kids are trying to go to school without a mask and they're being turned away. What good is this public school system if they're not going to teach the children unless they can mandate this mask that's not a law? I mean, it's not. Yeah. And so they're for children who that mask is harming, they're willingly putting them in harm's way.
Sure.
So that's the other thing. Can we then, if for children who are being harmed, we need doctors to stand up and say, this mask harmed this child.
And what's funny is there are doctors and they are stepping up, not because they're gaining anything. In fact, it's the opposite. Yeah. They're getting discredited. They're getting their reputations that go from highly regarded and well respected, and then they step up not because they're trying to get some notoriety. It's because they have an ethical backbone and they feel compelled to speak out with what they know.
Right.
And to me, I look at someone who's risking a ton risking everything, you know. I mean, Nancy the other day on Monday,
Yeah.
she really moved me. There's
Nancy Hill.
we have a nurse who has got an amazing family. I had an opportunity to meet her kids, and she's a single mother, and she's taking care of all those people, her family, her kids, with love and a good attitude, and her parents, and being turned away like this, being terminated. She's already terminated.
Yep.
She's done.
Yeah.
To me, the stories like that where I'm like, I'm speaking for her. I'm not even speaking for me right now. I'm speaking for her. It's time to step up.
Well, and so I want to play the video of you guys that made it to CNN, and then I want to play Inslee's response, and I'd like you to respond.
Oh, I'm gonna get fired up here.
Because speaking of Nancy, so I'm gonna play this. So I'm gonna play for you guys to watch. I have to cue it up here. Greg, you're gonna cut to it and do a okay. So.
And the debate is whether teachers should be required to get vaccinated.
Kind of long.
Washington State issued such a mandate earlier this week, and Oregon yesterday followed suit. Democratic Governor Jay Inslee of Washington State joins us now.
So we don't need to listen to like his whole stupid to your guys' part. Oh, here we go.
Mandates. Take a listen. First responders, a firefighter and a nurse, who were protesting these vaccine mandates. Take a listen.
We're being threatened with our job loss, our securities, financial loss. I mean, it's horrible.
At first they use fear, then they use guilt, then they use bribery, and now they're using force. That's how you manipulate people.
What's your response?
Look, if people make a decision to perhaps lose their life because they don't want cancer treatment, that's up to them. If they make a decision not to treat their heart attack when they're having a heart attack, that's up to them. But when you make a decision to expose our children and our patients to this deadly virus, when you have a tool at our disposal to use, that's an issue for all of us in the community. And this is a very American thing to do, to require all Americans and Washingtonians to come to the aid of their community right now. Shoot, George Washington mandated his troops to get vaccinated for smallpox. We didn't have the FDA in those days. He just knew it was a common sense measure against a common enemy. That's what we're doing here. It is not too much to ask to prevent our children from getting a deadly disease, to get a safe, effective, free vaccine. And the huge majorities of our communities have already done that.
So Culver.
So first, I don't think he's using children to activate people here, but go ahead and respond.
Oh man, there's so much to talk about with that response. First of all, you really got to come from two different points, because Ash, you were talking about the division we have.
Yeah.
And we're so far this side and so far this side, and we're a lot of the time there's these stances on moral arguments. The governor's moral argument is protecting children and not being American. So we have to be able to kind of bridge those gaps in a way. And to be honest, I haven't found the appropriate way to do it yet, because it's not being allowed. But again, that response as a leader to try to enforce people through shock and awe. I'm all about shock and awe if it's my 5-year-old kid trying to touch the fireplace.
Right.
But when you're trying to lead a country, when you're trying to lead a government, the information you provide and how you provide it should be well thought out. And that was fear-mongering, disrespectful, and pretty low. And you have these shock and awe kind of statements, like you said, protect the children, and
he calls earlier on he calls the virus a monster.
Yeah, and it's that kind of titling. And if you even started that with some sort of dialogue on proper information on how many kids are dying of COVID, and it's, I got to back up to a lot of points, because Robert and I we work in a field where death is pretty normal for us. So when we work a code and we see people pass and move on to the next life, or whatever you want to describe, but it becomes normal for us to talk about death. So I don't want to approach this as we're stoic and we don't care about these elderly people dying of COVID, but it's just a normacy in our lives that's just how we respond to it. But with even the reference to like smallpox versus COVID and how many people smallpox affected in relation to how many people COVID is affecting. The statistics on how many kids are being affected, and are those kids already sickly? I think it was 300 children for the year that died of COVID, and the majority of those children were
immunocompromised.
Yes, that's the word. Thank you.
They died with COVID or COVID connection.
Yeah.
Not
and it's not that type of information that's to be provided. It's this shock and awe. It's this fear. It's this terror. And it just doesn't work for the American people, and it doesn't work for me. So, and that's why I'm forced to ask these questions like, oh, am I killing kids? Because I have kids. I've risked my life to save kids. Man, I should really think about this, because in the last year and a half, Robert and I and a handful of other firefighters throughout the nation have been operating in this fear and not spreading it to our coworkers, not spreading it to our family. So our governor is saying one thing, and I'm living another thing. And all of a sudden, I can't do something I've been doing for 20 years, serving people, and I'm looking for work.
And yesterday you were a hero, and now you're a villain. Just like, our police officers. We saw it last summer, where the villain became the hero, and the heroes are now the villains. Yeah. It's so upside down and backwards.
Yeah, I look at what I saw there, and I didn't see that. That was the first time I saw that, and I purposely didn't watch it because it turns my stomach. Unpack what he said there, right? Smallpox is only in human beings. It does not have animal reservoirs. You can eliminate a deadly disease if it's only in humans. We're talking about the flu.
Right.
So what are you going to inoculate every bird, every animal, everything to get rid of a flu? So to use smallpox in that terminology is just, it's not thought out. It's either it was a snap thing to say, or whoever's advising him, it just seems silly to me. Like, it doesn't seem right. Secondly, the smallpox of George Washington's day vaccine is not a new mRNA technology that wasn't even designed or built in the first place to be used as a vaccine. At least according to Dr. Robert Malone, the gentleman who has the patent on mRNA technology. So I find it funny to hear him say that. And then another thing which I've been, trying not to be critical, but there was a time where I served as a president of our union, the Firefighters Union. And I had an open dialogue with Governor Inslee's office. In fact, they called me to find out what I thought about how he was doing. And I told them very, very clearly, I think it's an atrocious job. And the reason for that was I was sitting in my van right outside of hardware sales, and it was just, the pandemic had just started, and all these folks are masking up and wearing masks. And I could tell that my community was terrified.
Right.
And it was that first kind of time, early April, May, June 2020, where my community was terrified. And they were terrified because they were not getting good information.
Yeah.
And what I was seeing was sensationalized information rather than a very step-measured approach.
It was terrifying to see what's going on in New York, right? Because you think, oh my gosh, it's going to sweep this way.
Italy was another one that was
Right.
in the news at the same time, and all this was happening. I understand that, but even during that time period when we didn't really know, there was some very long-standing information, particularly about mask wearing, and that could have been shared in a different way. Instead, what I saw when I turned on the news and what I heard was out of the governor's office was, this sensationalization and this sort of terrifying everyone, our community.
The death count.
The death count and how we looked at the death counts and all.
Yes.
And it was just it seemed so irresponsible to me, and I told him so. And I told him so. And it was at a risk to my own reputation or how I was viewed. But I did it anyways because, again, for me, I feel driven, and I look over here at Michael. And look, this gentleman sitting to my right has done some things as a firefighter that firefighters in their entire career might never do in way of saving a person's life.
We can cut this part out. It's not a big deal.
Okay. It is I mean, I've seen this man next to me do the most heroic things, and I know he doesn't want me to say it, but it sickens me because of all the people for him to say that about.
Yeah.
Okay? This man has risked a lot to save a lot.
Well, he's clearly a brave person, and that's why he's stepping out now.
And I would like to know if that gentleman over there has ever done anything to risk his life to save another life. You know, what I've seen over here is sensationalization and is division and has weakened the community in this state. Mm-hmm. And it is appalling. It is appalling to have that kind of leadership. He knows better.
Right. Do you think he's on a trajectory of, because it became, put on the mask because you were scared. Well, first it was don't wear a mask and then laugh at people who might be wearing one. And then it was put on the mask because you could die. And then it just kind of, now it seems like it's an obedience thing, right? Yeah. Because we're going to mandate the mask like next Monday, but it's Thursday. So COVID's not really a problem until Monday. So, right. It's just this weird dynamic of how people follow it, and even people who don't want to. And then there's the plexiglass, which apparently COVID stops here, right? And there's no logic, right? But do you think he's on this trajectory of power and it, it's more big picture of do we need to be worried that it's more about power for him over us than anything?
Well, I guess mine is more of a hope or a prayer that, look, absolute power corrupts absolutely, right? So here we have someone that is maintaining emergency authority and emergency powers, and the way he seems to be maintaining that power really cuts out a lot of legislators and this. We're supposed to be a self-governing
right.
Government, right? We have 3 branches of government, and that's supposed to work. And this emergency use, this emergency authority that seems to keep renewing for month upon month upon month, where is that sort of looking to get back to a governance model that George Washington fought for?
Right.
Okay. Where is that? Because I'll tell you, George Washington didn't want to be a king. Governor Inslee
wants to be a king.
Is acting as a king right now.
He is. Yeah, and I'm not a fan of his, obviously. I as I work throughout the community, I see how much harm he is causing harm.
Hey, look, I supported Governor Inslee. Okay, like I said, in the roles that I had before, I was there for, working for our firefighters. Our firefighters supported Governor Inslee. They support him at the state level, and I was a good guy. And I made sure to follow through on those things. Back in 2019, we can argue what policy. We can argue policy for sure. And honestly, I have a photo of me arm in arm with him in 2019 as the union president. I'm not repping my union right now, but as the union president at that time, handing the man a check for his campaign. He was fundraising early in Bellingham, and so I'm culpable. I guess I was one of the folks helping him get reelected. And it wasn't until I saw sort of this abuse of power in 2020 early, and as the year kind of progressed, I saw all this hypocrisy that I had to, I started to have to do some self-reflection on, and what way I was complicit almost in helping this leader get it back into that position. And, of course, that was an internal battle for me. But, so I'm not someone that's just this long-term, always been critical of Governor Inslee. No, that's not the case at all. In fact, I've been a supporter of his. I've stumped for the man.
Yeah.
And of course, like I said, in 2019, that was a different world than we're living in today.
Totally different world.
And so it really had asked me and really twisted me up. In fact, it really kind of turned me off of politics altogether. Because next thing I know, I'm like, oh my gosh, I need to help. I need to help the other side now, And I just was, my mind was just, it was really tough. It was a hard thing for me because I found myself always playing between the 40-yard lines, and all of a sudden the entire football field lifted up and moved a different direction, and I found myself, and now all of a sudden, I'm this, I'm an enemy. I'm this, whatever he described us as.
Well, you're un-American.
Yeah.
But
un-American is defined as anything, in my view, as anything that takes away our freedoms.
Yes.
To me, that is simply un-American. If it takes away the freedoms that our country was built on,
yeah,
then that is un-American. And so it's funny to me that he would gaslight in that way. He would, what is that term? What's that terminology you use for like, if you're the liar and you call someone else the liar?
The pot calling the kettle black.
Yeah, it is.
Yeah.
But I think there's an
another
actual,
one?
I think there's a name for it. I just don't know what it is. But
it's like someone said this, like, you basically, if you're just going to accuse the other side of doing something that you're actually doing. Right?
Right.
So, was that Zelensky or whatever who says that? But I think he's been put in this emergency state of power, right? And so we've got COVID, and then it seems like COVID-19 dials down a bit. So then all of a sudden we have like drought and fire, and he's like, there's a new emergency, like everyone's got to get together. So it's like, oh my gosh, he's ramping it up. It's emergency climate change. And then it's like, oh, here comes Delta, and now it's Delta variant. And so there's this ongoing state of emergency now, and we're never getting out of it, it feels like. So I guess, if they called you today and you were still the union rep, what would you say to him?
Oh, I don't know that I would change my, I would know that I would change the words that were coming out of my mouth, but I certainly would change the way they were coming out of my mouth, I think. I would say, do better. Do better. You have a form of government that has been put in place by our forefathers, and to allow that form of government to manage the, what comes up. We've somehow been able to figure it out up until now. Mm-hmm. I think it's time that he allows us to go back to the normal form of governance that we've had up until now. We've got people that can do that. And then the other thing I would say is that the medical professionals guiding him, I think he needs to do a better job at looking at both sides of this. And he should be asking the question, why the censorship?
Yeah.
He should be asking the question. He should be the intuitive one, since he's the one making the mandates. He should be asking the question about what both sides of this and getting to the bottom of it. I think right now it's very negligence. I think it's negligence on his part by not doing that, or not addressing what's being said on both sides of this, and forcing us to do this, forcing any of his Washingtonians, his citizens, to do something that they don't feel fully informed on, and violating a basic human right like this. Man, oh man.
But I would push back a little, because I think it's intentional, because I've heard from his own mouth there's a video, and I posted a few times. It's of him during Bernie's campaign, in the primary for Bernie, and he's on a Zoom call, and he says, "Don't let the Republicans scare you away from using this pandemic for your agenda." He talks about global reset, economic reset. He literally says it.
Oh, he says it.
He says it. I will send it to you.
Wow.
So I would push back and say, I think he is the problem. He's doing it.
I would like to see that video.
And the legislators, because it's their agenda too, they're allowing him to continue because they hold the majority. And I think they're all complicit in this, and they are all doing it together. And, you probably didn't think that someone on that call was going to record it and send it to people, but he literally says it. And so when you're saying, don't let this pandemic go to waste, use it for your own agenda.
Wow.
Don't let them tell you it's not okay. I mean, it's chilling, right? Because, you want to respect the office no matter who's there. Yeah. Because we do live in America, and the person you vote for may not win. And, the person in the White House, I didn't vote for him, but I would like to see him succeed, right?
Right.
I would like, because when he succeeds, we succeed. I would like to see whoever's sitting there do well. And, Inslee's it's the same thing. I'd like to see him do well. Our county executive, same thing. I don't agree with any of those three, but I'd like to see them do the right thing and succeed. So I think, I don't want to be against people because they don't have the same political views as me. I want them to succeed, and I always want to hear what people have to say, because I can always learn stuff, right? Doesn't mean I'm going to change who I am or the values that I hold, but I can always learn where the other side is coming from and listen and ask questions. He doesn't want to listen. He's not asking questions. He's telling us.
Oh, yes, certainly. Absolutely.
So,
and you saw that. Remember in the beginning, it was like, I'm paraphrasing, but if everyone doesn't stay home this weekend, I'm shutting it down next week.
Right.
And then he shuts it down for 2 weeks. And then he's like, if everyone doesn't stay home for these 2 weeks, I'm going to make it a month. And it's like, and it was just like, he's telling you ahead of time exactly.
And he's lying. He's flat out lying. You can take off the mask if you get vaccinated. Your ticket to freedom is vaccination.
Right.
So people did it.
Right.
And he lied. And it's not the science. He lied.
Well, it's just funny to me to go from, I have opened up the state. And it was like, you saw it on the news, and he was at the fair, and he was allowing all this to take place.
Yeah.
I'm allowing this. And it wasn't even, what was it, 4 weeks later? It's mandated to every single employee.
Right.
Public employee.
Right.
And healthcare employee.
Yeah. And then teachers.
And then teachers.
And I think restaurants might be, I'm thinking.
How about the State Patrol? Are they mandated?
Yes. Yes. They just got all their exemptions denied.
Denied, yeah.
100%.
Why? Do we know?
Because he said no. All medical, religious exemptions completely denied. 100%. That was yesterday, I think.
I was notified this morning about it, yeah.
This morning, yeah. So I'm saying, I think it's his plan all along. I think he just wants to rule, and maybe we're going to break off as Washington State. I don't know, but it's sad.
Wow.
It's sad to see, and it's terrible. But so the one thing I want to touch on, and because in that video he also was asked, are you going to mandate vaccines for children? And he said not yet. That should terrify everyone.
Yeah.
It should absolutely terrify people, because even doctors are saying don't vaccinate your kids. Don't give your kids this, right? I mean, not my pediatricians. I have to go find a new one probably. But, there are doctors who are telling adults, you need to get this. Why aren't you vaccinated? Like, what? No brainer here, But don't give it to your kids, because they don't need it. They don't need it. They're not in danger. And so, I don't know. It should scare people. And I think people need to stand up and say no more and draw the line.
Well, yeah, and people need to. I think what needs to happen is, and again, look, if people who've taken the vaccine, I am no disrespect.
No.
I mean, look, this thing came out. You've had other vaccines in the past. This one's here.
Yeah. This
one's obviously been a huge problem. Your poor kid has been stuck at home, not being able to do anything. We're wearing masks everywhere. I want to get back to normal. You're telling me I can get back to normal. Doctors, are getting on the news and saying this is just like every other vaccine.
Yeah.
And so, yeah, you take your normal outlets that you would normally, what you would normally consume, and you listen to them, and you run right in. Oh, and then remember there was a shortage. If you remember,
Yep.
It was we might not have enough for you all.
They create that we
Right,
need that.
so you got
'cause
not
there's a
that
shortage.
FOMO going
Yeah.
on, right? That fear of missing out. So you had that, and then you've got these other things.
A lot of
where,
marketing.
Tons of kind of this weirdness about how we're coercing, I guess is the proper
it's
term.
totally.
I
I
guess,
mean, hey, take the
per
vaccine, you could win
definition.
money.
Donuts.
Donuts, not one, but now 2 donuts.
I saw joints for jabs. I saw that
That's-
come out once
yeah,
as
joints for-
well.
yeah, that's-
What
I
was the
mean-
other?
The liquor board was actually telling taverns and bars that say they can give out free drinks if they give them their vaccination card.
Yeah.
So-
So, and there's ice cream for children.
There was the guns
in
in
Sumas.
there was the guns in what was it? One of the eastern states. I wanted to say it was like a Carolina state, maybe, or
Yeah.
maybe it was West Virginia. I think it was West Virginia. They said, "Well, we're going to give away this, guns for jabs."
I don't know if that one's smart.
I don't know. I thought that was.
Yeah.
I thought that was interesting.
Maybe because
It's just the different ideas people have.
they probably get the gun but no ammo.
Right. There you go.
Yeah.
It's just all these different ideas for how to get people to take this vaccine. In the meantime, I had an inherent skepticism. I've had some issues in my life. My wife's aunt is crippled today from the polio vaccine. She was given a sugar cube and and then she's had about over a dozen surgeries now at this point, is crippled for the rest of her life from that time when she was young.
Yeah.
So there was that. I had an anaphylactic, which is a major reaction to a flu shot about 20 years ago. So I wasn't a huge fan of the flu shots. So but I used to just, whatever the doctor said, I'd roll up my sleeve and take whatever they told me to take.
Because you should be able to trust that doctor. And, the more I dive into pharmaceuticals and all that, I'm just like, this is a mess anyway. Like big pharma, big old mess. Yeah. Right? But, I think, again, we respect everyone's right to choose. And I don't know, we're going to wrap up here. I don't know if you guys can answer this, but people have asked, are first responders seeing injuries from the vaccine? I don't know if you can answer if you've seen injuries or not. But people now, there's more and more people going to the ER who are vaccinated, who need to be at the ER. I personally know at my husband's job, someone who works out there as a firefighter just went to the ER, tested positive, fully vaccinated, something wrong with his heart, and he knew right away, like, he's got to go. So starting to see that younger, super fit people, right?
Well, I can tell you, what I'll say is this, because I don't want to get into, what other people are doing.
Specifics.
But what I will say is this, is that, I have 2 brothers. They're both in the fire service in different areas of the country. And, one of my brothers was like, look, man, I had all these people take this vaccine and they didn't have a problem. Mm-hmm. And I said to him, are you saying there was no adverse reactions?
Right.
And he goes, well, no, that's not quite the case. Some people have described mild cases. Other people have described other things. I was made aware of one individual that had a lung issue that was like a pulmonary, like a clot in the lung that I know. There was another one where they got the COVID vaccine, nothing really, and then right after got a tetanus shot, a booster shot, and his entire arm swelled up and his glands all swelled up, and it was a bad reaction, but it was within a week of getting the COVID-19 vaccine. And so then he had this really kind of never before hyperinflammatory reaction in that area. So, are people getting that? Look, what I would say is this. If you really want to know what's going on, dig in, ask the Department of Health, what are you doing to account for adverse reactions? And how are those being accounted for? And they go, well, there's the VAERS website.
Which is so hard to do, and almost no one does it.
It's volunteer based.
Yeah.
What are we doing in our communities?
Right.
Look, my expectation of my employer or any employer would be, okay, there's this new thing. You all have to take it. Okay, here's what we're going to do.
Yeah.
We're going to make sure that we find out who's having adverse reactions, how many people are calling in sick after they're getting this. I would ask that we would at least be looking at all these different data sets to make sure that what we're doing is safe, even before forcing anyone.
Right. Right.
And if it is happening, it's invisible to us.
Right. Yeah,
So-
and I kind of had a question, like in my head the other day was, people who are vaccinated aren't supposed to have as bad as symptoms, but or the effect of COVID is not supposed to be as bad for them.
They're less symptomatic.
Less symptomatic.
Yeah.
But then that makes me think, because so I had COVID and I got it from somebody who was vaccinated who didn't know they were sick. Does that mean that the vaccinated don't know they're sick like maybe the rest of us would because their symptoms are less and now they're spreading it? I just wonder. That's all. That's all I'm going to say. Just wonder.
It's
So.
conversations like this that we need to start having, though.
Yeah.
I mean, between doctors of different viewpoints and different treatment plans.
Sure.
I mean, the fact that we're only pushing one treatment to do this fix-all is insane to me in working in the paramedicine field. So
Yeah.
these conversations need to continue, and proper data needs to get out.
Right?
Absolutely.
Right.
Absolutely.
Well, thanks for coming on, guys. Appreciate it.